Hi everyone, and welcome back to my weekly Sunday 9 p.m. live video. This is Dr. Tan Yiping, consultant obstetrician and gynecologist, and today my topic is precipitous labor. Okay, before I start, I just want to say hi and welcome back. It's been like a month since my last video because I was on a long leave. Partly, I went to US with my son to send my son to US to study. So when I was in US, I was reading some Malaysian newspaper news on social media, and this is what I saw. I think this news went viral. It was there in almost every news out there regarding this lady who was COVID positive and gave birth in the ward alone. Okay, so it went viral and there was a lot of comments from every angle. So today I just want to talk not specifically on this case, but on the topic of precipitous labor in general. Okay, so let's go back on this case. So what happened to this lady was she admitted to a hospital at, I think, early in the morning, around 5:30 in the morning, with signs of labor, I presume. That was why she admitted, and around 10 plus, she was sent to the ward, I think. And then around 4:30, they knew that she was COVID positive, and that was when the results came out. And then after assessment by the doctor, she was sent to a ward that is probably, or a room or an area that was meant for COVID-19 positive pregnant women. And she was actually planned for Caesar. Yes, that's what we usually do when you have COVID positive. If you're pregnant in labor and you need to give birth, normally most places we will actually push for a cesarean birth. So she was actually planned, but somehow at 6 o'clock she felt that her contractions suddenly became very, very strong, and she called and shouted, but nobody came to attend to her. And I think after a couple of minutes she gave birth. So everything went on very fast, and she gave birth shortly after she felt the very, very strong contractions. So my topic for today is precipitous labor. As the name would describe, it means fast, right? It means fast. And this is actually a condition that is well recognized in obstetrics among all of us. We all know what is a precipitous labor, and there are reasons of why it happened and what are the problems associated with precipitous labor. So in this case, by definition, precipitous labor is anyone, once you have a regular contraction, you deliver in less than 3 hours. So if you deliver in less than 3 hours, then it's precipitous labor. So that's why very often some mothers will tell me that I prefer natural birth. Natural birth not so painful. I don't like inductions because induction is more painful. Or when you ask them to induce, then they are very scared to induce because they hear that, they heard somewhere that induction is very painful. Natural birth is not so painful. But sometimes when they say that, I'm like, it all depends. Because why I say it all depends? Because of this particular condition called precipitous labor. So I usually describe to the mother, explain to them that ultimately it's how strong your contraction. If your contractions are very strong, irrespective of whether it's natural or induced, of course it's very painful. But if your contractions are not strong, then irrespective whether it's natural birth or induced, it is still bearable. Because in precipitous labor, it means that labor progress very fast. In order for labor to progress very fast, the pain has to be very strong. So not all natural births, the contractions are not strong and it's less painful. It is not true. Because I have mothers who tell me that, Doctor, my natural birth, scary man. I prefer induction, not so painful. Why? Because sometimes, like for me, when I induce, I tend to keep low dose. So if I keep low dose, then the contractions may not be as strong. But in natural, some of you do get very strong contractions yourself. So even some mothers who come in natural labor, but because their contractions are very mild and irregular, sometimes I also give them options, I will ask them, what do you want? You want this contraction that is mild, that will drag on for maybe another day or two, or you want something really strong and get over with it. So depends on each mother. Each mother has their own opinion and choices because depending on what they prefer. Some mothers like it fast and finish with it. Strong but quickly finish. It's like going on a roller coaster. I always describe birth sometimes can be like exactly like going on a roller coaster. So if you choose to go on the roller coaster, no matter how scared you are, you will face it and over with it, because really usually roller coaster is very fast and over very fast too, and it's quite scary, the thing that you have to go through when you sit a roller coaster. But if you have a slow and steady birth, it may not be so unbearable, but it will drag long. So it is very individual. Okay, so in precipitous labor, the first thing is they need to have very, very strong contractions. And that's why in this case, she mentioned that at 6 o'clock, suddenly the contraction became very strong. So suddenly out of nowhere, it's just triggered and the contractions became very strong. And that was why she started calling for help. Okay, so in precipitous labor, the first thing is the contractions are very strong. And next, they birth very fast. So what usually happens? And to tell you the truth, precipitous labor happen everywhere, anywhere, and have happened all this while. Whether in government hospital, in private hospital, first time mother, third time mother, fifth time mother, it happens anytime and everywhere. Even with my own experience in a private hospital, I also had patients who, you know, even though the midwife just sit outside the room, but still the mother gave birth without anybody in the room, because they didn't expect the mother to give birth so soon. Because the mother just examine, sometimes the midwife may just examine the mother like 10 minutes ago, and maybe 10 minutes ago it was like 4 or 5 cm and she thought should be fine, and then another 10 minutes she's like screaming and then pushing the baby out. I have also mothers where, especially when they have epidural, they totally have no feeling of the contractions, right? So when the precipitous labor came in, or the strong contraction came in, they didn't feel anything. And then next moment she just screamed, and then when the midwife ran into the room, the baby is already out. Although the midwife just examined the mother half an hour ago and had no signs of her going to give birth soon. But because her precipitous labor set in and her contractions were so strong, but she doesn't know because she's on epidural. And then suddenly the baby just popped up. And then by the time we went there, the baby is out. The mother did not even push. Okay? So you think about it. Is that what you want? Do you want a very fast labor that you do not need to do anything, and before you know it, baby is already out? I think again, it's very individual. Some people may want it, you know, it sounds nice, but honestly, it's not so nice, because the pain is horrendous unless you already on epidural. So when you have this very, very, very strong pain and end up giving birth without anyone in your room, in fact, I had one of such case in my own practice as well, because the midwife did not know that the mother had a precipitous labor, and suddenly the baby just gave birth. And this one, you must understand, this is before COVID, nothing to do with COVID. And this patient, I still remember, this mother, I still remember, her room was just in front of the counter. It's just in front of the nurse's counter. But usually, because in labor we give you privacy, we close curtain, and just in front. And then she had such strong contractions, but she didn't scream or shout. And then suddenly when she just screamed, and then the baby just popped out. But she did mention to the nurse earlier on that the contractions was very strong. The nurses examined, she was only 4 or 5 centimeters. That was 10 minutes ago. And now 10 minutes later, baby just popped out. And this particular mother, it was a very traumatic experience for her. It is one form of birth trauma, because number one, you were in so much pain. And number two, the baby gave birth, you on your own. So most of mothers like this, I tell you, there are mothers who gave birth on their own, but they don't find it so traumatic if they didn't have very strong contractions. And the other way around, those with very strong contractions, but they were delivered by midwives or doctors, they also don't find it that traumatic. But when you combine both together, it is a very traumatic experience. So I can imagine this particular lady had a very traumatic birth. Okay, let's talk about precipitous labor. Why? I'm sure you want to know why. Okay, so the few causes, we know there are few causes. One is, we say, abruptio placenta. What is abruptio placenta? Abruptio placenta is something to do with related, not necessary, but it's in this whole complex of high blood pressure, preeclampsia, growth retardation of the baby, as well as low water level, low amniotic fluid level, and abruptio placenta. All these things is like a group of events that are more or less related, but can occur together or individually. So in abruptio placenta, what it means is premature separation of the placenta. You see what happens in normal birth is baby come out first. Baby come out first, then the placenta separate, then the placenta come out. But in abruptio placenta, the placenta already separate, but the baby still not born. And this type of situation, the pain is very, 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 very strong. That's why when we see very, very strong pain, we always worry about abruptio placenta, because abruptio placenta can be related to certain complications like fetal distress, baby lack of oxygen, so causing abnormal heartbeat, and also possible baby death. So abruptio placenta is kind of dangerous. And the other depends on the severity of the placenta. Abruptio placenta. Abruptio placenta, you can have mild, moderate, severe. The severe ones are usually life-threatening to the baby, not the mother, but to the baby. So abruptio placenta is due to premature separation of the placenta before the baby is out. So this condition is very dangerous, and it can be linked with high blood pressure or may not be linked with high blood pressure. It can be linked with high blood pressure, preeclampsia, fetal growth retardation. That means the babies who are small, that a bit undernourished babies before they were born, as well as reduced amniotic fluid volume, but it is not compulsory. Okay, this is the first condition. Second reason for precipitous labor is infection. Infection of the uterus and the placenta. So if you have infection, then you can trigger a precipitous labor. And the third reason, we say we don't know. Some people, they just get precipitous labor for no reason. Suddenly, the contractions just very fast and everything over. Okay, so these are the reasons for precipitous labor. So not everyone have a reason for it. So it can happen to anyone. So although to certain people, they may like it because it's over fast. Some people actually like fast labor, strong, fast, over with it. If I can give birth in less than 3 hours, wow, so good. But not everyone like it because the pain can be very horrendous. So are there complications of precipitous labor? Number one, bleeding is a lot more. When we see mothers who give birth so fast, when we go to the hospital and deliver a baby that we know the labor progress so fast, all of us in our heart, we know we have to be prepared for excessive bleeding, which was also mentioned in this case because she said she bled a lot and she was very fretful at that time. So it is something we expect to happen because when contractions come too strong and labor progress too fast, they tend to bleed more. They also tend to have more tearing because you must understand that everything needs time to open, and if you don't give your body time to dilate and open slowly and stretch out slowly, they tend to tear. So you have more tearing either outside or inside on your cervix, and sometimes even at the uterus, especially if it's cases of people with previous cesarean birth. If they have precipitous labor, they have very high risk of even rupture of the ooska because everything is just too fast and too strong. These are the complications, and of course fetal distress. Baby can be too stressed up over the labor. It's not just a mother stress. The baby can also be very stressed during the labor because the contractions are so strong, and therefore you also have higher chance of fetal distress, fetal oxygen deprivation to the head. That means they have lack of oxygen going to the baby's brain and causing brain damage, and also baby's life in danger. So a lot of things can happen with precipitous labor, and that is why precipitous labor is something that we hope it doesn't happen, but sometimes we can't prevent. Is there any way we can control it? Yes, there is. There are medications that can slow down labor, that can slow down the contraction, but we have to think first before we give. Why? It's because in abruptio placenta, we cannot slow down the contractions. Because if we slow down the contractions, the separation will cause more bleeding, and there's actually more fetal distress and more complications. So in abruptio placenta, we cannot slow down. In infection, sometimes also we feel that we cannot slow down because it's better to get the baby out fast before the infection get into the baby, hopefully, because if the baby is infected, then there will be also a lot of complications to the baby when the baby is born. But in cases where you have precipitous labor without infection and without abruptio, in these type of cases, of course, we can slow down the contraction. But the problem is sometimes we have to be very, very sure that this is not infection or abruptio before we can slow down the labor. So in these type of situations, more often than not, we are not so comfortable to do that because unless we are very sure, if not, we get into more trouble. So most of the time, we monitor the baby closely, and because it's going to be a fast birth, the good news is it's going to be fast, so it's going to be over soon. So as long as the baby's heartbeat is good and it's going to be over soon, most of the time they are fine. So like in this case, other than the birth trauma, which is more of a psychological trauma that she endured, and probably excessive bleeding to a certain extent, but otherwise the mother and baby is well. Because in most time with precipitous labor, even though we say there are certain dangers, but the good thing about precipitous labor is everything is so fast. And because everything is so fast, everything will be over so fast, maybe will be out fast, and everything will be over, and most of the time mother and baby is well. So there are situations where precipitous labor and the heartbeat was not good, and when we pushed the mother to the operating theatre, they didn't even reach the operating theatre. They can give birth on the way to the operating theatre, at the operating theatre, or just as they enter the operating theatre. These things happen almost every other day in labour wards. Okay, we see heartbeat drop, we push, and then patient delivered even before we can do any cesarean birth. So that is why precipitous labor actually is very common. But if in combination of precipitous labor and unattended birth, which can happen like in this case, as well as many other cases I've seen, both in government and private hospital, it can still happen because it just happened too fast. It can be emotionally and psychologically traumatic to the mother. If induced and birth within 2 hours, consider precipitous labor or not since induced. Normally, we still say it's precipitous labor because even though it's induced, because even when we induce, normally, let's say if you come into labor and we think you don't have regular contraction, because what we define as precipitous labor is the beginning of regular contraction to the point of birth. Okay, there are two situations. Let's say you come into hospital, you have no contraction at all, and then we induce you and you gave birth in less than 3 hours. Yes, this is still a precipitous labor because you were not in actual labor. We induced, but it also happened too fast. And whenever it happened too fast, the possible complications are the same. So we will still have to think of certain possible complications, but 2 hours plus, not so bad. Because I had this one lady, I know her births are always so fast. So when I induced her, you know what happened? I induced her. She came into hospital. It's like third pregnancy. And when I examined her, she was like about 3 to 4 centimeters. She's not in labor. She just came for an induction because her births are always very fast. She worried she cannot reach the hospital. And guess what? I just break her water bag and I walked out of the labor room. And then when I reached my car, the nurses already called me. And then I went back and then she delivered. Not even half an hour. Not in labor at all. All I did was break her water bag. Within not even half an hour, she delivered. And you must understand, for her to actually birth so fast, from like 3 centimeter to 10 centimeter in less than half an hour, her contractions must be very, very strong. So that is why for her, she is very, very scared to give birth on her own. I mean, waiting for natural birth, because she's very scared that she will end up giving birth at home or on the way to the hospital, which will be a bit complicated. So that's why she chooses to be induced in her third pregnancy, because she's always so fast. So I think that's all today for today's topic. So yeah, short and sweet. Okay, next week, I think most likely I'm going to talk about women's metabolism and weight gain. Okay, because somebody posted out this question of weight gain after a surgery to remove her uterus. So I'm going to talk about that next week. Okay, all right, so that's all for now. Thanks for tuning in and see you again next week, same day, same time. Bye bye.